Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, a licensed midwife and one of the MCs here at Gold. And here at Gold, we're getting ready for our Gold Midwifery Conference 2026. I almost said 2025, but it is 2026. Get started there in February, and we're working on a very special add-on package here at Gold. And this is the lecture pack of Gold Postpartum Care in Practice, Clinical Strategies for Physical and Emotional Recovery. And I'm here with Dr. Isabella Garti. Welcome, Isabella.
Thanks for having me. It's good to be back.
It's good to be, it's wonderful to have you back here at Gold. Your topic is a very important one and something that I've been wanting to bring up for quite a while now. And I'm so glad you are very available for us to lecture on this presentation topic. And the topic is the silent threat after delivery, recognizing the hidden sign of postpartum preeclampsia. I want to talk to you a little bit about that. But first, let us know a little bit about you. First of all, where in the world are you, Isabella?
I'm joining you from Darwin. So Darwin is at the top part of Australia in the Northern Territory. And currently I work here at the Molly Wadaguga Institute for First Nations Birth Rights. I'm a research fellow here. And yep, that's just about it.
Yes, and you have done extensive research on the topics of preeclampsia and so much more. So, how did that become an interest of you, these research topics that you really, I love that you're providing us with evidence-based information. All the research you provide has been so valuable for midwives in the field. So, tell us how did that become a passion of yours?
Oh, I think that pre-eclampsia is a very common thing in Ghana. And I quite
Mm.
remember that when I finished school for the first time as a very young midwife in 2007, so that's like really long time ago, and I started taking care of women, I noticed that more and more we would see women come with preeclampsia and we didn't really know what to do. So I think that was where my interest first started from. Because I was wondering, like, if we are midwives and if this is so common, how come when they come, like, we're all scrambling and we don't know what to
Hmm.
do and we feel helpless? And so that's where initially my interest started. Along the lines, I had a friend, a very good one. She was also a midwife. She developed preeclampsia, but she died with her baby. So that
So
was
sorry to hear
it.
that.
It was really
Oh,
traumatic.
yeah.
But also, it was a rude awakening that, well, somebody has to do something. We have to step up because in Ghana, midwives are the main providers of care for women. We see the woman first. Oftentimes, we are the only point of contact in those remote places, those first places when they are pregnant or they've had a baby or they're seeking for help. And so, yeah, that's where the interest started. And I began to learn more about preeclampsia. I began to ask questions. And I realized that if we do all the right things, the women live.
Hmm. Yeah.
And yeah, it's just been a really great journey from there. Also trying to
Hmm.
educate other midwives and teaching other midwives to
Hmm.
provide that evidence-based care that saves lives.
Well, thank you. And thank you for sharing that very personal story with us, that very sad story. And that really got you to really, really do a lot of work in this to kind of carry that legacy for your friend. So thank you so much for sharing that as well. And yeah, you're saying like preeclampsia is common, and even here I'm practicing in the United States and North America. We have it here too. And why is it, Isabella, that we're all educated on the topic? How is it that we still often or we're recognizing the signs late, or that still, some women are falling through the cracks. How is that?
Yes, I really think that it's also about midwives and our philosophy towards birth and care. The thing is, I
Hmm.
do recognize that as midwives, we sort of like hold the fort when it comes to normal birth and normal pregnancy and all of these things. So we do that really well. We
Hmm.
support women really well. But then we also need to recognize that about 10 to 15% of women will develop a pregnancy complication, will have some sort of complication. And so we need to be equally armed to care for those women as well. So even though we always emphasize the normal, we also need to be ready to care for women who experience the
Mhm.
abnormal. So I feel like sometimes that's where we get it, like we miss the
Mhm.
mark with that one. We are so focused on everything normal. And so when this woman is
Mhm.
coming with all these subtle changes and all of those things, we can't really recognize it. But sometimes it also boils down to our education. And that's why conferences like this one are really important for midwives to learn more, to refresh their knowledge. Because what we
Right.
know about preeclampsia now is not what we knew about preeclampsia 20, 30 years ago.
That is correct. And because of people like you, researchers, right? Because you give us the data too, and we have new ways of looking at it and practicing. Absolutely. That's why all this is so important. Now we talked about preeclampsia, and for the longest time, all of us were taught, okay, the cure to preeclampsia is birth. Once the baby is born and placenta, we are in the clear. Woohoo! But I think what we're realizing, or that postpartum preeclampsia is also, a very important factor that maybe it is not as common or as prevalent as preeclampsia, but it is something that we don't talk about enough. And because we don't talk about it enough, it can be overlooked. And often also because once the baby is born, it depends on where we practice, right? Like
Mhm.
maybe we only depending on our schedule. If you're not working in a hospital, when are we doing the next home visit? Or are we having continuity of care? Is there some other care provider taking over after birth? So I feel like this is such an important topic, and I'm so glad that you are talking about it. So there is so much to be done. So tell us, why is that we have a lot of emphasis. We're learning more and more about preeclampsia, but the postpartum preeclampsia is still a little bit kind of a neglected topic.
Yes, Christine, once the baby is delivered, the story isn't finished. We've just opened a new chapter. So this
Yeah.
is how I look at it. It's like when a woman is pregnant, we take it to be like we are on a voyage to this tropical island somewhere.
Mm.
And so, we're looking at our maps, we are in the boat, we are putting up our sails and everything. We have the captain, and, we're just trying to get the woman to that island, or we're just all trying to get to that island. And then we arrive on this beautiful tropical island,
Mhm.
and there's no map. We don't know. So, where do we get the food? Where do we get the water? Where do we get this? So, that is how the postpartum period is beginning to look like.
Mhm.
What we call the fourth trimester is often overlooked and very
Yeah.
neglected. So even in general, normal postpartum care, there are very few guidelines, there's very few instructions, very little is done for the woman at that point because we think she's had the baby safely, the danger is over, we've done our job. But it's
Mhm.
only the beginning. It's a new chapter. So this woman needs to be closely monitored. She needs all the care and support in the days that should follow
Mhm.
to make sure that not only did we get her there, but we got her there safely and she's still safe and well. And so I feel that like we really have to put more emphasis into the care women receive in the postpartum period, because when we are aware that conditions like postpartum preeclampsia can rear their ugly head for the first time, then we can take swift action, and then we can also make sure that women are empowered to seek or reach for support early on, and then we can
Mhm.
also give them
Yeah.
prompt evidence-based treatment to ensure that everything goes well and they don't experience very
Yeah.
bad adverse outcomes.
Absolutely. And I feel like there's also a lot of misinformation still around on the topic because many
Yeah.
people think, oh, I didn't have preeclampsia, so this can't happen to me. Or, I had a perfectly healthy birth, or, my birth was easy and healthy baby here and everything is fine. So that these things can, and also, as you mentioned, we are so focused on normal and normal birth, that as midwives or as care providers, we might also think like, oh, that was a butter birth, as we sometimes say, right? It was an easy butter birth. What can possibly go wrong now,
Go wrong. Yeah.
And I feel like there is so much, and that's what you will be talking about too, that we can do, and we can educate the family also, and other care providers and family members to maybe look out for any warning signs as well when we're not there. Let's say if it is in a situation when mom is and baby are discharged, or it was a home birth and we're, not coming for another couple of days back, To look at it. But how, Isabella, how would you talk to family members about a topic like that without scaring them, without feeling, putting them, setting them on edge that something, oh my goodness, something else to worry about, what's happening here? We don't want to, after that beautiful birth, annoy them, but we still want them to be, alert. How would you approach that?
Yes, I think that you've asked a very good question, Christine. Even this year, 2025, the WHO has come out to advocate for more midwifery-led models of care, just to emphasize that relational continuity of care. So if already this woman has had care from a consistent provider, her midwife, that she's built a relationship with,
Mm,
is built on trust and all of these things, then I feel that if you explain to the woman that, hey, there's something called postpartum preeclampsia. You may have had a very healthy pregnancy, but this condition can turn suddenly. It can be very silent, but can
mhm.
be devastating, even if your pregnancy was healthy. Then this woman is more likely to be receptive. However,
Right.
it is when she is just blown away because it's somebody new just telling her that, hey,
Yeah.
this can happen to you and all of that. So that relational care is what sets the scene for us to be able to speak to women about some of these complications without scaring them, because by
Mm,
that time we have communicated with them severally, and so they know
right.
our
Mm,
voice. They know the kind of ways we explain things to them that they understand. But
yeah.
one of the key things also is to include the woman's family.
Hmm.
Educating patients must not occur. I don't even like to call a pregnant woman a patient, a
Right.
client, a pregnant
Hmm.
woman and her family. It has to be in tandem with the family, because sometimes when things are happening to you, it is your husband, a friend,
Right. Hmm.
your mom who can tell or who will help, or sometimes
Right.
they may be the barrier to your seeking care. So
Yeah.
when we educate the woman and her family together, then we can allay all their fears and anxieties and explain to them that, hey, yes, it
Hmm.
sounds scary, but we'll be here to walk the journey with you.
Yeah. Wonderful. Thank you so much. Yes, I love what you said about the continuity of care and also the relational care, building a relationship if you can through pregnancy and so they feel really also. And I agree with you. I don't like to call the women or the family patients. I like to call them clients as well, and they're partners in care. We're not, they're not patients that we tell them what to do. They are, we are a partner together as a team, so to speak, in the care. So they have also are able to make decisions, of course, and be partners in care. So that absolutely wonderful. Thank you so much, Isabella. Before I let you go, any final words that you would like to share with our audience? What are you hoping our viewers will take away from this presentation?
Like I always say, midwives, we spend the most time with women, and we have the ability to transform outcomes simply by seeing what others may miss. So I'm hoping that the midwives who join us for this conference will be able to discover why postpartum preeclampsia, for example, is frequently missed. I'm also hoping that they will understand that they have a critical role to play in terms of like being the woman's first line and sometimes her lifeline to whether
Right.
she will live or she'll be very sick. And also understand how making just small changes in our practice can save women's lives. And I
Mhm.
also think that this presentation can also be used by women and their families, because at the end of the day, they will get to know much more about postpartum preeclampsia, and that information will be able to help them advocate for themselves or seek help when they need it.
Wonderful. Well, Dr. Isabella Garti, it has been such a pleasure having you back here at Gold, and I can't wait for your presentation. Thank you so much for being here with me today.
Thank you for having me.
And
Bye.
here's some information for our viewers now. If you're really interested in this presentation, the silent threat after delivery, recognizing the hidden signs of postpartum preeclampsia, which is part of the lecture pack, the postpartum care and practice, clinical strategies for physical and emotional recovery, which is an add-on package to our Gold Midwifery online conference. Please go to goldmidwifery.com. You'll find out all the information, and there you can also sign up for our free and open access access keynote presentation for the conference. We get started live on February 2nd. Of course, everything is also recorded, so you don't have to worry that you miss anything. Share that information with your friends and colleagues in the field. And I hope to see everyone at the conference. Thank you so much for watching and have a lovely rest of your day, everyone. Bye bye.